into this. Here we go. Admit all. I'm going to here we go. Now people can just join. I won't have to make them wait in line. Hey, good morning, everybody. We're going to get started shortly. This is our Villages of Santa Fe Medicare 101 program, and we're glad to see you here today. I'll be introducing Brad Coe in just a moment. We'll wait a few minutes. We are got a couple more minutes before we get started. If you have questions, please put them in the chat or raise your hand, and then we can, let me make sure you're allowed to unmute yourself. Let me check on that. Host tools. Yes, you can unmute yourself, but please keep yourself muted during this presentation so we don't get a lot of background noise. I appreciate that. So, Brad, have you been following the balloon fiesta?
Not a lot. It's one of those things where when you live here and they land in your yard and stuff, it's not that big a deal. And try to stay away from it because it's
Oh, the
very
traffic.
busy.
Yeah.
It's just unbelievable. And I keep on talking about this. Like somebody shared with me not too long ago how they go to a football game in Dallas
Uh-huh.
and there's a 2 lanes or 3 lanes going each direction. Well, when the game is going to start, they have all 6 of those lanes going in one direction to the stadium,
Yeah.
and then when it's all over, they switch it to where all 6 of them are leaving. So, I mean, it still is busy, but if you're going to get 85,000 people out of there in a manageable way, they do it. And, I just sit here and look at the cluster that goes on down there, and nobody seems to really want to make a solution about it. And I don't know why, because I feel bad for the people. I'm watching it on the news or I'm going outside and looking at it in my view, and they're starting to go up. And on the news, you're still seeing that Alameda's backed up still for like 2 miles. So I'm like,
I
well, you're not
know.
even going to see it, you
I
know?
know, but it's beautiful. It's
It
beautiful.
is
I did
beautiful.
it last year with my daughters-in-laws. Anyway, we're all chatting because it's the balloon fiesta down in Albuquerque, and I believe it's the largest balloon fiesta in the world. I mean, we have like 550 or 600 balloons going up in the mass ascension. And yeah, the traffic is just horrendous. But boy, the view of the balloons are just gorgeous. But anyway, welcome this afternoon or this morning, wherever you happen to be. I'm Ann Church. I'm the founder of Villages of Santa Fe. And every year at this time, we present Medicare 101 and Medicare 101 versus Medicare Advantage, which will be next week at the same time on the 14th. And we welcome you coming to that as well. So this program is about basic Medicare and Medicare supplement programs. Like I said, next week we will get into Medicare versus Medicare Advantage programs. This is presented by Villages of Santa Fe. We've been doing this with Brad Coe since 2016. Brad is an independent agent, but this has absolutely no sales, and we can't discuss individual policies. But anyway, Brad has been offering us insights and helping us choose Medicare and Medicare Advantages programs since 2016. With so much news about Medicare, don't miss this opportunity. Open enrollment starts, I believe, on October 15th this year and ends again on December 7th, I believe.
Correct.
Correct?
Correct.
Okay, so I just want to make sure I get those correct. So If you have questions, please put them in the chat or raise your hand. Once you raise your hand, you can unmute yourself. We will try to keep things moving along well. Again, this is a big overall about Medicare itself, and it's a very complex program. And I have been on this call 8 years now, right?
Yep.
And every time I learn something new. So don't despair. You'll get through it, but every little bit of information helps. So again, I want to introduce Brad Coe, and I'm going to turn it over him and then just mute myself and let him go with it.
Oh, thank you very much, Anne. And again, it's my pleasure to be here. Again, I always look forward to this presentation with everyone because it just gives us all a good opportunity to get our head on straight as we go into this very busy time here. But, there's still probably some on this call that might be coming up to where they're starting to get into Medicare. So it will definitely help you. Anne already kind of talked about one of the housekeeping pieces about this is that this is an educational meeting. So that is a specific type of meeting by the Centers of Medicare and Medicaid, CMS. So we can only give out educational information. So there's nothing specific about any kind of plan. So if you have a question, you can say something like, well, my Medicare plan did this, but don't be telling me ABC Medicare, please. And second is I am not an employee of the government. I am not an employee of Medicare. As Anne said, I'm a independent producer and I end up representing all the companies out there, well, most of them. So I have a good non-biased way of going about things instead of being captive at a carrier. So with that said, let's get into this, and I will do my best to kind of keep things moving along here because we can get bogged down and it ends up taking more time than we're expecting to, and I don't want that to happen today. So, Anne, do I have my screen up, the presentation?
Yes, I see your full screen. We're starting there with the Medicare 101, Warner Pacific Guide to Medicare.
So Warner Pacific is my general agency. So everybody like an independent like me has to work under a different level. That's who Warner Pacific is. Here's our agenda. We're going to go through a little bit of the history of Medicare and then go over. And when we get to the additional information, it kind of is where we'll try to add in maybe some more specific ways about Medicare on how you can handle it under certain situations. And then we'll try to leave some time for some questions at the end. So let's get this party started here. Medicare is actually a health insurance plan. So when somebody has just Medicare, let's say original Medicare, then that is their health insurance, and it is administered by the Centers of Medicare and Medicaid. The CMS is an agency within the Department of Health, so you'll hear when they're talking from Washington, if it says HHS or Health and Human Services, I mean, keep an ear open because it could affect Medicare. Social Security office processes applications and collects the premiums for Part B and Part A if necessary. Now, so we have two federal government agencies that are administering Medicare. We've got Centers of Medicare and Medicaid that handle the benefit structure and the claims processing, and we've got Social Security Administration that's going to handle the enrolling and the premium collection. So, depending on what you're trying to do, if you're coming up to Medicare, what do I do? Well, you go to Social Security initially to end up getting enrolled. And then later on, if you're like, well, I don't think that that's paid for what it was supposed to, or what's my benefit with this, then that would be something with the Centers of Medicare and Medicaid because there's a claim issue. Started back in 1965. It was a fee for service. So essentially, you got services and there's some coverage, but you ended up paying for the services. And I like to add also during this time, because it'll come into play later on, that it was or is based on the old system of insurance, which is medically necessary. So when we start getting into the preventives and the Medicare Advantage plans, you'll see kind of why the difference is because of the difference between a fee for service. And beneficiaries can see any provider that approved by the Medicare program. So here's this wonderful red, white, and blue card that everybody sees. I had to laugh when I saw this because the number that they have here is the old number. Now it's 11 digits. It's got numbers and letters in it. So it's not your Social Security number anymore. Medicare covers 68 million people. So when we start this, it's like, well, Medicare is a very delicate piece because it has so many voters in there and they participate. So if something's going to go ahead and affect their benefits, then they start getting involved. It's for people age 65 years or older. Now, this used to coincide with when you could get Social Security. But now, as more people are coming in, okay, like for instance, my full Social Security is age 67. So I can get Medicare before I can get full Social Security. So I like to separate those two now because they've been so kind of correlated throughout the years. You can also qualify for Medicare if you have end-stage renal disease, have some other disabilities like Lou Gehrig's disease, and you can also qualify through Social Security disability if you're on it for 24 months. So if you're on the Social Security SSDI for 24 months, the 25th month, you will be put on a Medicare. Now, when I'm saying Medicare, let me backtrack a little bit. I'm referring to Part A and Part B, original Medicare. So, and I will explain what those components are. Sort of the history here, we already talked about it starting in 65, 72, started adding the people with disabilities. In 97, we ended up adding the Medicare Advantage plans. And then in 2003, we ended up adding the prescription drug plans. So all of these, so people say, well, what happened before that? Well, we made it work one way or another. So prescriptions were being covered, but now they said, well, we don't have to do it. We need to create a specific program to have the prescriptions go through. In 2009, Medigap or the Medicare supplement plans, there was some that were eliminated. We've ended up getting to the point where the last elimination of one of these plans was January 1st of 2020, and that was a Plan F. So if anybody's on a Plan F or a Plan G, possibly, I'm sorry, J, that's a dinosaur. You get off that, you're not going to be able to get back on again very easily. But just kind of know that. So, as Anne said, Medicare can be very, very confusing. But the confusion kind of comes in more so from um, from that insurance companies are involved with coming up with some of the products that fit into some of these categories. So what happens when we start dealing with private insurance companies? Now we start talking about marketing and advertising. And this is where, if you aren't familiar with how the base system works, it's confusing because you get one thing from a carrier one day, you get another thing from the same carrier the next day, and it's saying something different. Well, that's because they are different. They fit into different parts of Medicare. So we've got Part A, Part B, Part C, and Part D. This is as hard as it gets. So please stay with me. I know when we start getting into some of the details, it gets you get a little bit worried about the amount of information, but this is as simple as it ends up being is A, B, C, D. So original Medicare is Part A and Part B. So those were the originals. And as we went through with the history, then Part C and Part D were added in there. So when somebody says I'm on Medicare or I need to sign up for Medicare, it's actually original Medicare that we're looking to get enrolled in. And that ends up being Part A and Part B. And we'll discuss what those are. Both hospital and medical coverage can be obtained through a private insurance company through a Medicare Advantage plan. Part C, outpatient prescription drugs, is where we end up dealing with Part D. So Part A is inpatient hospital. So if you're admitted into the hospital, not under observation, if you're admitted into the hospital, then Part A benefits are going to go ahead and apply. Anything between, if you're not admitted in the hospital and it's not a prescription, okay, now it falls into Part B, the medical part. So Part B is very, very broad. And then, of course, like I said, we've got different ways to approach this with Part C and then the prescription drug plan. With government plans, as with anything that we deal with the government, is there have to be specific periods of time that you can do things. You just can't do it willy-nilly, or they would just be inundated or bogged down even more. So what we deal with Medicare is eligible enrollment periods. So as Anne mentioned, we have the annual election period, or AEP, coming up here for October 15th through December 7th. Now, that period is for anybody who wants to change Medicare, that you can change it during that time. You can change it as many times as you want during that time, but the last one, the latest one that you change it to, will be the one that goes into effect, and it'll go into effect as of January 1st. So if I put you on ABC Insurance Company on October 20th, your benefits will not start until January 1st of 2022. So all the stuff that I'm talking about really at this point is I'm going to try to give you the numbers for 2026. This presentation has the numbers for 2025 because the numbers are not haven't been approved yet, but we kind of know what they are, so we have some kind of idea. Other election periods are the initial enrollment period. So This is when somebody's turning 65, or like back in that other screen, if we've got a disability or we're at the 24th month of being under disability. Those are initial enrollment periods. You have a 3-month period. Well, let me say this. You have a 7-month period under the initial enrollment period to enroll in original Medicare without being penalized. Now, why would you get penalized? Because again, on the old system of insurance, that they wanted everybody to be covered. The law of numbers. We need everybody involved in here, or we need everybody who is going to participate in this. So what I'm talking about with this is that that on the enrollment period of the 7 months, the penalty ends up only applying if you don't have credible, which is the operative word, credible insurance, meaning, okay, let's not complicate this. I work for an employer and he offers me, or they offer me a health plan. I'm going to stay on that. So original Medicare says, okay, you have insurance, so you're not going to go ahead and potentially be a burden on us later, so we will let you go. Most people are talking about either retirement or something like that around this period of time. And so that's when they get in. And the 7-month period is 3 months prior to the month of the birthday, the month of the birthday, and 3 months after the month of the birthday. So you can enroll in original Medicare during any of that time if the initial enrollment period applies to you, and you will not get penalized. The general enrollment period really only falls into play when you don't get on the Part B of original Medicare when during your initial enrollment period. So they won't let you just go, 6 months and then you're like, well, I'd like to go ahead and get back on Medicare or sign up for that. Now you've got to wait until January 1st through to March 31st for an effective date of the first of the following month. So if you waited until March to go ahead and get in this to re-enroll or initially enroll in Part B, well, then the benefits will start in April. The special enrollment period is a fairly broad area where they let different people that have exceptions end up being in there, being able to go in there. So for instance, somebody who, like I said, my example of somebody who still works for an employer, let's say they continue past age 65, past their initial enrollment period. And 2 years later, they're like, you know what, it's time for me to retire. Well, now you have a special enrollment period that you now can go ahead and enroll in your A and B without penalty. So these enrollment periods, they've been the bane of my existence, because if you don't get the right enrollment period down, well, then things keep getting kicked back and it holds up enrollment. And that's not what we want to do on something like this. Let's dive into Part A here. Typically, Part A, the hospital part, inpatient hospital part of Medicare, does not have a premium. Now, let me say that maybe a little bit differently. It does have a premium, but if you have met certain requirements, and essentially the requirements are that you have paid into a payroll system, because you see your check stub and it says FICA tax, SUTA tax, and then one of the lines is Medicare. That's why they're asking you to be part of a payroll system, because you've paid into the system. We consider you then entitled. And if you're entitled, you don't end up having to pay the premium for Part A. The if you end up not having all the quarters for Part A or all the years, let's say, um, then you end up paying a decent premium. And if you have like under 30 quarters, so 10 years or 40 quarters. So if we add that out, that's the 10 years. If you're under 30 quarters, then Part A can cost you $563. So that changes the landscape a lot about this. So when people say Part A is free, it's not free, but you're entitled and you don't get to charge. You're not going to get charged for it. Age 65 or older and a U.S. citizen or permanent resident, and you are eligible then. The federal government funds Part A costs through the Social Security payroll taxes. Um, for people who pay the premium, if you buy Part A, you will pay. So this is the number I just gave you, but this is $518 is the 2025. $563 is the 2026 number. So I'll be updating you as we go to these numbers on what it looks like the 2026 numbers are. But don't come back to me later and say, hey, you said it was this and they're telling me it's that. These aren't, they're more than likely what it's going to be. There is a late enrollment fee. So again, it gets back to we got to do things in a certain time frame. If you don't purchase Part A when you're first eligible, you turn 65, your monthly premium may go up 10% and you pay that 10% penalty for twice as long, twice the number of years that you could have had Part A. So if you were out of it 1 year and get onto it, you're going to pay the penalty for 2 years and so on. Part A is pretty straightforward because we're used to looking at, going into the hospital and okay, X-ray is going to cost me this, labs are going to cost me this, and itemizing it. And that's not really how it works with Part A. There is a deductible here. The deductible in 2025 is 1,676, and it's going up to 1,716 in 2026. So you're admitted into the hospital. You're going to get assessed with this deductible charge. It's a 60-day deductible. So you either stay in the hospital for 60 days and then you transition into the 61 to 90 days, or let's say you're in for a more normal period where you're in for 2 days, let's say. But if you're admitted after your discharge, the 60 days starts the clock. And if you're readmitted within that 60 days, then you don't have to repay that deductible. And when you're discharged that time, the 60 days starts again. Again, if we're in the situation where you're in there for the first 60 days, and then it goes into more days, we're talking about a $419 a day for the next 30 days. So you can see how something like this ends up really kind of getting out of control on the cost that it can be. We're looking at, let me see, it's going up to $429 dollars in 2026. And then after, if you're there for 90 days, after 90 days, everyone has a 60-day lifetime reserve of days. And that's what we'll start going into on that. 2025, it's $838 a day. In 2026, it looks like it's going to be $858.
Hey, Brad,
After you, uh-huh.
I had a question here. We had an earlier question. We'll get that one later. But somebody said their Part A premium is only about $175 a month. But wouldn't that be their Part B?
That's their Part B.
Yeah, okay, that's what I
So,
thought. Okay.
that's their Part B. Yes. Okay. Now, what else does it say? Inpatient hospital is always the easy way to explain this. But what about inpatient rehab? Skilled nursing, it's called. Well, that's covered under Part A also. We can see it's a 100-day benefit. The first 20 days, Medicare pays 100% of it. So anybody who you seem gone into skilled nursing, the facilities typically try to get everything accomplished within the first 3 weeks so that they know that they're going to end up getting paid. Because if we spill over into the 21st day up to the 100, in 2025, the cost per day is $209.50. And in 2026, what did I write that? It's 200 and I'm sorry, I thought I had the number down. It's a little bit more than that. I think $214, I think is what it is. So again, keeping within these parameters or having something else you can see can help pay for this, for these out-of-pocket expenses. And that's what we get into a little bit later here. Part B, the medical. Again, if you're not admitted into a hospital or admitted into a facility, let's say, and it's not a prescription drug, then it falls under Part B. You must enroll and pay Part B premiums. So everyone, unless you're dual eligible where you have Medicaid also, but if you just have Medicare, you're going to pay a Part B premium. They will bill that premium to you until they being Social Security, will bill that premium to you until you end up starting to collect your Social Security retirement. Once you start receiving that check or that distribution in your checking account, they take the liberty, Social Security takes the liberty to take out the premium out of that. So Social Security and Medicare premiums are very closely related. And I won't get into a whole lot of it, but what everybody sees is that you get a cost of living increase for Social Security. So everybody's looking forward to it. And then Medicare Part B comes in and ends up like saying we're raising our premium. So there's very little of excess after that. And that's by design, quite frankly. So knowing, so when they say you've got that you're getting a cost of living increase, just also know that there's a follow up to this one, and it's going to be probably that the Part B premium is going to be increased. Part B premiums usually go up each year and are higher for individuals with higher incomes. So this is a very good point that what they charge you for your Part B premium is based on your income from 2 years ago. So why do they go back 2 years? Because if it's a year, sometimes people don't have their taxes done. 2 years, pretty much everybody has their taxes done. So they look at it. So for 2025, they looked at your 2023 federal income tax to determine what your premium was going to be. And they have a scale on this. And in 2000, I think I'm jumping ahead of myself, but since we're talking about it, that in 2025, if you filed taxes single, if you made under $106,000 on that 2 years ago taxes, or if you filed joint, it's a $212,000. If you made less than these numbers, well, then you're going to be charged the base premium. The base premium right now for Part B is $185. The number that we're looking at for for 2026 is $206.50. Now, I'll get on my soapbox a little bit right now, but we have to really be careful about this because these numbers, are still all manageable. But I've been doing this for, 20-ish years, and it was really inexpensive back then, and it has crept up. And my concern is that it's going to end up getting slowly but surely more unaffordable. But there's my soapbox. I'm sticking it back underneath my desk, and away we go. Um, like I said, premiums are deducted from your Social Security, and then the federal government fund pays 25% of your costs through the general revenue. Beneficiary premiums cover 25% of the expenses. Um, If an individual delays Part B enrollment, again, initial enrollment period, you decided not to get on it because you're healthy. Well, I don't really. That's not how they think. They want everybody involved right from the beginning. So you end up having a penalty of 10% for each 12-month period that you were not enrolled in Part B. And this is the penalty applies for all years going forward. So Part A, it's only for twice as many years as you were not covered. For B, it's a lifetime penalty. If you don't get enrolled when you're initially eligible, the initial enrollment period, then that's where we get back to the general election period of January 1st. And again, we do this enrollment through the Social Security Administration, okay? Yeah, as of 1/1 of 25, Social Security office never doesn't accept walk-ins. That's not necessarily true, but it's not hard to get an appointment either and show up. You can go online to ssa.gov, and that's where you can go ahead and enroll in Original Medicare Part A or Part B online. And that's the way that I recommend people go, because then they don't have to be burdened by traveling or trying to be on the phone with who knows how long it's going to take. Here we go again. Let's have an example. So we've got Betty, who turned 65 in July 21st, 2025. Look at that, 2,225. I'm sorry about that typo. She will have group health coverage from her employer until she stops working in December 31st, 2025. So we've got a couple things working here. We've got an initial enrollment period that she has. She's got a couple of enrollment periods that she could utilize. The initial enrollment period is going to end up being then 3 months prior to July. So April, May, June, she can enroll in it. July, she could enroll in it. And then the 3 months after, August, September, November, she could. But she has a credible coverage from her employer. So she doesn't have to go ahead and enroll in Part B. She can hold off until she ends up retiring at December 31st of 2025. So then we get down to the special election period. And that ends up being an 8-month period after from when you lose coverage. That's what they call it, loss of coverage, because you're left your employer and you lost your coverage. So from January 1st through August 31st, she has an enrollment period that she could enroll in Part B without any penalty. If she misses that, then she's got to go into the general election period of January 1st through March 31st. Here's where we get back into what I was talking about with those numbers of 2026. We're looking at that figure being $109,000 for individuals, and over on the joint filing, it's 218. So that number, so they're accommodating for it, but you can see at least in 2025, and this is going to hold true for 2026, that if you make more than that base amount, then your premium for Part B is going to be higher. So the person that ended up saying, "Hey, I've got this coming out of my Social Security," that asked that question earlier, we're looking at there being an increase. There's going to be more taken out in 2026 for that same coverage. So you can see that if you make a lot of money, it's going to cost you a lot of money for your Part B. Physician services in and out of the hospital, supply, speech therapy, diagnostic tests, and durable medical expenses. We end up having Part B has a deductible. There's no co-pays or anything like that. So when you join Part B, you end up having that you've got to cover the first $257 of that. What the number is that we are moving to in 2026 is $288. Again, they're creeping up. After that deductible, then Medicare pays 80%, you'd pay the other 20%. And then excess charges, you pay nothing, covered. Here are some good screenings to get an idea. We, for a long time, didn't have any preventive service. It was medically necessary, as I mentioned. Now we have some preventive things, but it's a very scheduled time frame of what you can do. Some of these you can do annually. Some of them you have to wait a year or two before you can go ahead and have them done. If you just go online and look up Medicare preventive services, you'll get the whole list and everything. What you're looking for with Medicare is providers who accept Medicare assignment. Medicare assignment is going to be what Medicare has determined, like for this service, we're going to pay this, and they've gone ahead and accept that this is what's going to happen. There are providers, though, that do not accept Medicare assignment, but they still accept Medicare. These guys can go ahead and they'll accept the assignment, but they can also charge you a Part B excess charge of up to 15%. So something to think about. So here we've got real simple. Part A, you got to be admitted into something. Here's all these things that we've seen people or heard of people that have gone through: hospital, skilled nursing, hospice, healthcare services. The B is going to be outpatient, if you will, physician services. You're not admitted into the hospital. So all of this. And one that I like to add into this list is observation at the emergency room, because they'll keep you overnight. So you're thinking that you were admitted and you weren't technically admitted. You were under observation. So that goes under Part B also. So what we've gone ahead, what it doesn't cover, Part A and Part B, is you've got your coinsurances and deductibles that you be responsible for, routine hearing exams, screening and hearing aids, routine eye exams, eyewear or contacts not associated to cataract. So here's the difference here that we're looking at. If it's medically necessary, so I've got cataracts, it's a medical piece, well, then you end up having, then Part B will cover it because it's medically necessary. If you're just looking to go get your eyes checked out and a new pair of glasses, it will not cover that. We've got the custodial care, cosmetic surgery, most outpatient prescription drugs. Why does it not cover them? Because they've got Part D that's going to cover them. Okay, but in the hospital, your prescriptions are covered. Dental care and traveling while outside of the United States. Now, again, we're talking about just original Medicare. Now, What we get into is Part C at this point. Now, Part C is a program. It's easy to say A is for inpatient, B is for medical, D is for prescriptions. C is a program, and the program is where the government allowed private insurance companies to develop their own Medicare plan that was as good or better than original Medicare. All right. So what I pretty much summed everything up. What they do is the insurance companies will come up with a plan, and you no longer are accessing your care directly from Medicare. You're accessing your care from the insurance company, and they are accessing what financial benefit they get from Medicare. So they kind of get in between you and Medicare, but they have to cover everything that original Medicare does. And they can cover, it has to be as good or better. So when I'm looking here at the bottom here, we can see when you're seeing those commercials of things that say, hey, you can get routine vision, fitness benefits, dental benefits, that is the or better on Part C. So they've got a lot of value in them. You have to be entitled for Part A, so entitled, and enrolled in Part B, residents of the Medicare Advantage plan service area. So somebody lives in Santa Fe, and then they move to Arizona, let's say. Well, you are going to have to look at your plans that are available to you out in Arizona because that's outside of your current service area. And you have to do it within the eligible, between the required time frame. So we're back to that enrollment periods that we were talking drug plan. Now, this was the big topic this year because of the the Inflation Reduction Act. It used to be very complicated. We tried to make it simple by saying it was a donut and stuff, but now what we've done is we've reduced it down to basically two categories, and it's your below catastrophic and catastrophic. Below catastrophic falls into two subcategories, which is a deductible and then initial coverage. So if you have a prescription drug plan embedded into your plan or you have it as a standalone, they typically have tiers or the levels of drugs that are going to fall under the deductible. If you have one of those drugs, those prescriptions, you'll have to cover the deductible first before you then transition into the initial coverage. So let's say ABC Insurance Company says that we're going to go ahead and we'll pay 25% of our tier 3 prescription drugs. Well, you're going to have to pay the $590 first, and then after the $590 is satisfied, then you end up having then the 25%. And that's a calendar year, and it is not per prescription. It's a calendar year deductible. This amount is going up to from $590 is going up to $615. So again, these bad boys are starting to creep up for sure. We get into the same financial piece about this because if you end up making under those base amounts that we were talking about, the 106 or 212, or if we're looking at 2026, the 109 and 218, well, then you're going to pay what the premium of that prescription drug plan is. Sometimes it's $0. Sometimes it's $85. That's what we review with to see what's going to be more suitable for the plan. If you made more than these numbers 2 years ago, then they're going to charge you this extra amount. The extra amount for Part B and for Part A is called the Income Related Medicare Advantage Adjustment, IRMA. So if you get something that says this is your Part D IRMA, that means that they believe that 2 years ago you made above those thresholds, and so now you're going to get charged more. Uh, so this was all introduced in 2023. I believe the first plans came out in 2025. The coverage ends up being, effective January 1st when we're talking about the when you become active. Plans that are administered by private insurance companies and like Part C, these companies take financial risk. So you could have your Part D embedded in your Part C. So I have people calling up saying, hey, I have ABC Insurance Company Medicare Advantage plan. What do I need to do for my Part D, my prescriptions? Well, it's already packaged in with that. Financial assistance for premiums and cost sharing amounts is available to low income and institutionalized. That's something that you think about. I talked earlier about being eligible for Medicaid also. That can help out with some of these costs. If you're not eligible for Medicaid, but you don't make a whole lot more, there's a program called Extra Help that ends up coming from the federal government that'll help you pay for your prescription drug plans. And then the bottom piece here is what we're talking about with Medicaid. So this is always the slide that I feel is the most important slide, because this is how we administer Medicare. You have two ways of administering your Medicare. As we have on the left column here, you can have original Medicare as your health insurance. So your red, white, and blue Medicare card is your insurance card. Your network is anybody who accepts original Medicare. But what don't we have with those two pieces? Original Medicare, we don't have outpatient prescriptions, and we've got some exposure because we've got that $1,700 deductible for being admitted into the hospital. We've got that amount that if you're in skilled nursing, that's over 20 days. So what do? We add in a Part D plan to go ahead and cover your prescription drugs. So now we have a comprehensive plan. You've got hospital, medical, and prescription drug. And then a lot of times we go in and add a Medicare supplement plan. A Medicare supplement plan is not health insurance. It is supplemental. Your health insurance is original Medicare, okay? And then the supplement plan pays if Part A and Part B pay their portion. So you're admitted into the hospital. Yes, this is a Medicare approved service. You get you have a $1,700 deductible. Okay, the Medicare supplement comes in and says, hey, I'll pay a portion of that, depending on what plan you want. The other option here ends up being the Part C. And this packages everything in together. And so now you get a plan that you're used to seeing kind of under 65, where you're not asking, well, what's my hospital benefits and what's my medical benefits? You're actually just asking, what's my copay for certain things? So how much is it going to cost me to go see a doctor? How much is it going to cost me to go in the emergency room? Those things. So there's a lot of value in them, but here's the pros and cons to each of these ways of setting up the design. On the first side on the left, a Medicare supplement plan has a premium and it will go up, okay? So typically with that premium, and if we annualize it 12 months, that you pay more consistently more money for this type of design. But you end up getting access to all doctors nationally who accept Medicare. Part C, a lot of benefit, a lot of bang for your buck, but now you have to work within that insurance company's network, and they can have an HMO, they can have a PPO, and they can have a fee for service. And now suddenly we've got to check to be sure that this doctor is contracted with ABC Insurance Company to be sure we go. So we get back to those network challenges. Not a lot of network challenges on the original side with D and Medicare supplement. On the Part C, you just have to be aware of it and manage it. So with additional comments here, I'm going to attempt to go into one other piece to go over very quickly. Where's my share screen?
I've got your Medicare supplement up now. It says lesson 3.
Okay, good. I
Um,
am slide show.
but I don't see the whole slide.
There, how's that?
Um, there you go. Yeah, I see the whole slide. Good.
Okay. So this is the Medicare supplement plans, and we'll go through this really quick because we've already talked about this. Again, it's not insurance. It's not your health insurance. It's supplement. It is the only product that you end up having with an insurance company where you don't have a network. The only way that this pays is if original Medicare paid. So it works very much in tandem with original Medicare. So people think it's all one big plan. It's not. So that $1,700 deductible ends up getting paid by Medicare's supplement plan. Okay, that just know that it was two separate components. They have different policies that we'll quickly go over. And again, you've got to go ahead and enroll in these in certain time frames. These help with the out-of-pocket, like we've stated here in Original Medicare, sold by private insurance companies. Some policies will cover benefits Original Medicare doesn't, like medical care, emergency medical care, when you're traveling outside of the United States. This is key. They are all standardized plans. So the next screen, we're going to be at the table of these benefits. We're going to go ahead and see that they're all the same. So if you have a plan G, you're going to get no different benefits from one insurance company to the next. Okay, but what they can do is charge you a different premium. So, and then of course, we've got a couple of states that do things a little bit different. Here we go. So we had mentioned this, that Plan G, if you look here, this is what the Medicare supplement plan will pick up. That Plan F is no longer
Brad, I don't,
available.
I'm still on lesson 3, Medicare supplement Medigap policies. Did you need to move down to the next
Uh,
slide?
I have, okay, so it looks like it's not
There it
going
is.
under
There it
slide.
is. You got it. You got it.
Okay,
Great.
so here we go on the Plan G. So you have original Medicare, Part A and Part B. That's your insurance. But here, Plan G will come in and pick up these end very much in tandem with original Medicare. So we talk about the Part A coinsurance or the Part B co-payments, the 80% blood, hospital, hospice, the Part A deductible, the 1,700, the Part B deductible, the 200 and what is it, $16 or something for 2000 and and 26. So you can see how these will reduce your exposure, but you end up having, there's an expense for them. And there's other plans, though, that you can get. The Plan N has an awful lot of the same Plan Gs, but you've got some copays. Some people like to have a little bit of exposure. So on the Plan K, it pays only 50% of certain services up to $7,220. These plans cost less premium than a Plan G because they're not covering more. They put it towards you. They put the onus or the responsibility on you. So these are really a powerful tool to help to reduce your what we call exposure, what your potential costs could be when you go into a plan, but you got to be ready to go ahead and pay the premium on them. So this really just comes, can I get a Medigap policy if I have a Medicare Advantage plan but want to return to original Medicare? Yes, you can. That's what we do in the annual election period that we're coming up to. But you've got to go ahead and be transitioning back to original Medicare. You cannot have a Medicare supplement plan and a Medicare Advantage plan. Um, what if I have other supplemental coverage like from an employer? Well, we always try to figure out, is your employer better insurance than the Medicare? Can I afford the Medicare deductibles and copays? If you want to have a consistent amount premium every month and have your copays covered, or you can go ahead and take the risk that when you get admitted, you're going to get hit with something. And then again, we get to the bottom one here of the monthly cost for these plans. Again, they vary from carrier to carrier, and they can end up being, a decent amount. We pretty much we try to coincide with the enrollment periods for Medicare and supplement plans with original Medicare, but it's basically from the first day that you have Part B Medicare. So if back in our example of the lady who turned 65 in July, that her enrollment period for the Medicare supplement starts July 1st and it goes for 6 months. So we usually just have everything start on the first day, and that ends up being what we and then everything kind of goes together. Okay. Am I stopped sharing right now, Anne?
Yeah, you stop share.
Okay. So there we go. I'm trying to kind of keep it in here. I know we went over a lot, so you can kind of see that it falls into the four categories: Part A, Part B, Part C, Part D. You end up having either A, B, and D with a Medicare supplement plan as one of your ways of going about administering Medicare, or you can accomplish all of that through a Part C plan, a Medicare Advantage plan. There's pros and cons to both of these that you have to take into consideration. So people ask me, well, what's the best plan? We don't use best in my industry because it's subjective. One person is going to think that having access to all the doctors nationally that accept Medicare is a priority. Other people are going to say, I don't want to be paying the monthly premium for the Medicare supplement plan. I'd rather just work with my regional hospitals and providers. So that is Medicare in a nutshell. We go into this, you enroll in original Medicare, and then we choose a path that we're going to go: original Medicare with a supplement and a prescription drug, or a Part C plan, a Medicare Advantage plan, and that's how we administer it. And then we take advantage of this annual election period that we take a look at things and say, am I happy with it? Has my plan changed for the next year? And we have an opportunity to change at that point. So that is all I have. Are there any questions out there, Anne?
In the chat, somebody was saying they have original Medicare, and so they have original care, a supplement, in Part D, and talking about changing during the open enrollment and would they be subject to a physical?
So, Affordable Health Care Act comes in and it says that health insurance can no longer discriminate based on health. Okay, so when we're talking about these components that we have, what pieces fall under health insurance? Part A, Part B, Part C, and Part D. The Medicare supplement plan does not fall under that because it's supplemental insurance. It's not health insurance. So what this question is can you move from a Medicare Advantage plan to original Medicare? Yes, but the Medicare supplement plan is going to go ahead after your initial enrollment period when you turn 65. After that period's exhausted, then yes, they're going to ask you more questions because again, now they don't have to worry about covering all the risks. They can go ahead and charge you a higher premium, rating you up is what we call that, or they can deny you altogether if you have a problem. So last year, perfect example, and I'm not trying to make fun of this person, but he calls me up. He says he just got diagnosed with cancer and he wants to move to a Medicare supplement plan. That's not going to happen because they're going to go ahead, they're going to ask the question. We're going to have to answer it honestly. And they're not going to go ahead and accept that. They don't want to accept that risk. He wanted it because he could go to these different doctors and stuff, but no, he's going to have to work within his own network. Anything else, or are they being easy on me today, Ann?
I think the problem is with Medicare, it gets so overwhelming that you're just kind of standing there in shock. Like I said, every year we do this, and every year I'm like, oh man, oh, do I have to look at this again? But I do have to say, I think one of the things that happened, I know when I first signed up I have original Medicare and a supplement, is I believe I had a lot, I mean, the rates did increase through my supplement, but I believe it had a locked in rate, what it was going to increase by each year, wasn't it?
Yeah, it did. You had a locked in rate that it was going to. So they gave you a discounted amount when you first got
Yeah,
in, and
yeah.
then it was going up a certain percentage every year. But what the insurance companies do now also is if their entire book of business is increased, so if they say we want another 3% increase throughout our whole book of business, well, by the end of the 12 months of that, you're going to get a 6% increase. Your three that they're going to get back from the discount, and then the three that they added because their whole book of business increased. And we got hit with that then this last year really hard, or this year, I mean, that was the highest increase we'd ever seen with that. And, so the 3% plus the 15% was an 18% increase overall.
So somebody also asked, and um, when do we sign up for Part B? I think I think the situation is Part A and Part B are over here. You might want to read this question. I'm not really sure what it is. It's in the chat. I think it's I think the answer I think they're asking about it. Oh, I think they're kind of mixing Advantage Plan and Plan D. I'm not sure. Can you read
I
that?
can explain it. I'm the one that wrote it. Do
Oh,
you want to
okay.
hear it?
Okay.
Okay. I want to know, like, soon if I sign up for the plan A. Now, I'm already on employer plan. I'm not sure if I want to go on to the Advantage plan, but if I do want to know, like, if I sign up for plan B, I would have to start paying. Then I would have to wait until the Advantage plan kicks in. So it's terms of timing. And how would I tell my current insurance if am I Medicare, but I don't have the other parts together? Am I going to get cut off from my insurance if I have Medicare, or if I have Medicare but Part B, but I don't have the Advantage? How is the timing of all of this? Is my
Sure.
question.
Sure. So again, we're talking about somebody who is not in their initial enrollment period. She's
I am.
employed.
I am in the
Okay.
initial. They're giving me. I called a few weeks ago. They're giving me an appointment to call. They're going back and saying when you called us, that counts. And I'm really still in the 3 months.
Okay. So during this time, what we're trying to do is have everything start on the same day. So if you were looking to go ahead and have, so when you enroll in Part A and Part B, sounds like you're entitled, so you won't have a premium for that. But as soon as you enroll in Part B, yes, they are going to charge you the premium. Now, do I have a lot of people who continue to work and stay on their employer plan? Yes, they do. A lot of times what they do is they'll go ahead and sign up for their Part A because they're entitled and there's no charge. So essentially what they have is double coverage for inpatient hospital, and it's not costing them anything more to do that. But they hold off on the Part B because they don't want double coverage for the medical and they don't want to start paying the Part B premium. When we're talking about a Medicare Advantage plan, you have to have Part A and Part B. So we're looking at when is your date that you end up having both A and B. So if somebody enrolls in Part A during their initial election period for January 1st, let's say, but they don't enroll in Part B, well, we can't get a Medicare Advantage plan. You have to have them both. When you join Part B, now that opens up the enrollment period for that. And you can join Part B during, again, the 7 months. So with Part A, you have the same 7 months. With Part B, you have the same 7 months, okay, I'd like to sign up for Part B November 1st. All right, well, we've got 3 months prior to November and 3 months after November that we can go ahead and sign up for Part B. But once you're signed up, when we have, okay, as of, let's say, December 1st, or we said November 1st, you'll have both Part A and Part B. Okay, now that is your enrollment period then for Medicare Advantage plan. So that would be when you would get into a Medicare Advantage plan.
So when I'd have to hear from Medicare to say you're signed up for Part A and Part B, then I can sign up for an Advantage plan.
Correct. Correct.
Okay. What happens in that time period with the insurance that you currently have? If they're asking you, are you on Medicare? Are you on Medicare? Are you on Medicare? They just, they want to break your back on this question. Once if I say I want to sign up for A and B, do I have to wait till I actually get it? When do I have it? When I get it, then is there a gap time between when they have it, but they don't have the Advantage plan? I'm kind of bare there because my other insureds will drop me, right? Because I signed up on Medicare.
Well, okay. You're kind of getting into a point where now there are employers now that don't want the for lack of a better word, please forgive me if somebody gets the burden of paying the premium on their on their group plan for people who are 65 or older. So they can go ahead and say, if you're on Medicare, then you can't be on the group plan. They cannot force you off. They cannot force you off, but you've also got to make sure that your employer plan is credible. What does the credible mean? As good or better than original Medicare. So if it's credible, then you could continue until you decide when you want to get off of the employer plan. That then is going to open up an enrollment period. If you're in your initial election period, if you're trying to go ahead and make that work, again, it just kind of you tell the employer when you're coming off of that if you decide to transition into original Medicare with A and B. But up to that point, they can't force you to do that. But so it's up to you when you decide to. The reason why they're hounding you is because the premiums for a 65 plus person on a group plan are absolutely egregious. They're just horrible, and it costs a lot of money. And you, so my win-win is you typically get better coverage for less money under a Medicare than you do on an employer plan. Oh, and one last thing. The employer, if you're an active employee, the employer can pay your portion of it. So let's say the employer splits cost shares, we call it. So they pay 50% of the premium on the group plan. The employee pays the other 50% through their payroll. Well, they can do the same 50-50 split on your Medicare also, so that you don't have all of the responsibility of the Medicare plan. So I hope that answered your question.
Yes, it does. Thank you.
Okay.
I think we had one of the questions, something about coverage as a dependent. It's in the chat there.
Oh,
Um,
I have gone down this.
yeah. Sometimes I
I
don't
have
really quite
coverage
understand the
as a
question.
dependent until my husband retires. We don't know. Okay, so I have coverage as a dependent until my husband retires. Okay, so the spouse is working and on their group plan, they are the dependent. We know when we will retire. How do I make sure I have continued coverage? I'll be 65 in March. Okay, so um, my question is when is your husband retiring?
Well, that what they said there, they don't know when he'll retire. So,
Oh, we don't know when he will retire. Okay. So yes, then I would agree with what you answered your own question. I would go ahead and sign up for part A because then you have double coverage. But then, if he retires after March 1st, well, then you go into that loss coverage. So you fall under the same requirements as an employee who's leaving coverage. So you would fall under that same requirement. Like, okay, he decides to leave July 1st of next year. All right, that's when your special election period starts for that. What do we typically do? We typically try to have whatever design you want, whether it's the original Medicare with the supplement and prescription drug plan or the Medicare supplement plan. We have that all start on July 1st. Why? Because June 30th is probably going to be the last day that you have coverage, and we don't want to have those gaps. But the retirement will be what initiates your enrollment period.
I think the main thing here is planning a bit in advance because, it's always going to take you a little bit longer to figure out what kind of plan, first of all, to figure out what it really means, and then what kind of plan, and whether you want original Medicare or you want Medicare Advantage. Again, I think, Brad, as you pointed out, is Medicare Advantage is regional and original Medicare is national. So
Right.
if you live in a rural area, it's going to be tougher because you're going to be very limited to your Medicare Advantage programs. And a lot of carriers don't want to cover rural areas. There's just not a lot of money in it for them. But but original Medicare is more expensive.
Yes. Yes. Well, original Medicare isn't, it's when we add that Medicare supplement plan to it,
Yeah, that's true. Yeah.
that's where it becomes more expensive.
Yeah, yeah, yeah. But I do have to say, like with I've been really happy with my Medicare supplement program because really I haven't seen anything out of pocket And I have surgery coming up. And as we had a conversation, I don't think I'm going to see anything out of pocket, which is just the bomb.
Yeah,
It's
you
great not
shouldn't see
not to have to
anything.
worry about it. Yeah,
Yeah. So, I mean, and again, it sounds great, but you've been paying your premiums and
I
you
have.
just got a
Yeah,
hit. You got hit hard on your premium. So when I do a review of somebody who has a Medicare supplement plan, I'm like, okay, do you do you have a problem with the benefits or the or the network because it's staying the same? And typically they say no. Then the last question is, do you have a problem with the premiums? Because that's the real onus on those. So essentially, you're paying up front
yeah.
for the luxury of going ahead and being able to go into the hospital and have whatever done. And as long as it's covered by Medicare, then your plan will pick it up at 100% because you're on the plan F.
Right, right.
Um, so, but you know,
It really is that cost situation. Can you afford the premium right now? If you can and you want to have that security, or I have people that can certainly afford the premium but love their Medicare Advantage program. So
I
it
agree.
it's really a personal decision, but I want everybody to know this is why we do this, so everybody has the facts. So don't forget, next week we have actually we're going to dive into Medicare Advantage programs and more information on the difference between the two. And it's going to be at the same time. It'll be October 14th, 11 a.m. Mountain Time. You can sign up. We'd be love to have you. If you happen to be in Santa Fe, we do have Boomer Tech back. It's down at the downtown library. That's tech help with your individual your individual phones and laptops and computers. That is presented by Villages of Santa Fe and Santa Fe Prep, and that's the downtown library, October 29th. You can go onto our site, Villages, I'll put it in there. And also, we have this recorded, and we will have the recording up tomorrow afternoon. If you go to our site and click on the blogs, it'll be there. Thank you so much. We really appreciate your attending and the great questions. And
Thank you
thank
so much. I
you.
appreciate the opportunity.
Thank you, Brad. We'll see you next week.
Take care. Bye.
Bye, everybody.